that Assemblyman Albano, Assemblyman Milam, and I have been working really hard on this issue. It was right here in Cape May County, believe it or not, that the public advocate became involved with the issue at Chapin House. And there was a lady, a senior citizen, who lived there in the assisted living facility for a number of years, a good number of years. And she spent down, true story, hundreds of thousands of dollars, everything she had living in this facility. Once she spent everything down, they attempted to involuntarily remove her from the facility. Now, ladies and gentlemen, that is wrong. You're right. That is a wrong thing to do, and that shouldn't happen, and we all believe that. Fortunately, we were able to work with the public advocate. Probably many of you saw it was on, I think, just about all the networks, that this particular facility really did get in trouble. This is assisted living concept. So let me tell you, when you speak about arrogance, I personally called the CEO. They advertised on their website in the computer that in order to maximize profits, that they were involuntarily going to move as many Medicaid people out as possible, and that they were going to try to ensure that when people spent down, that they were moved out. It was unbelievable, and it was on their website. They had no remorse, didn't care. In fact, they're involved with litigation with the public advocate right now, who has done a wonderful job on the issue and has really been fighting hard on it. It sparked an investigation throughout the state where they found dozens of cases throughout the state where people were pushed out. And by the way, this lady had a letter from her local doctor here, right here in Cape May County. And again, this spread throughout the state that we found out about it. The doctor said that she was so fragile and so vulnerable that if she was involuntarily moved out because she had lived there so many years, she very well could pass from this earth. They did not care. Fortunately, we were able to keep her there. But the bottom line is a couple things. One, in that case, they had made an agreement. They had made an agreement in order to get something called their certificate of need, which allows them to operate, that they would be committed to taking care of a certain number of people after they spent down and a certain number of people when they went to Medicaid. So they broke their own agreement. So in their case, they're in trouble because they made that agreement. All assisted living facilities that are established after the year 2001 have to take, as our legislation says, the bill that the Assemblyman and I have, says that after the year 2001, that you must take at least 10% of your population should be folks that are on Medicaid. Most of the folks are actually folks that spent down. At least 5% should be direct admissions, to be fair. We're not trying to put assisted living facilities out of business. We're not trying to reduce the number of assisted living facilities that are available. We're just trying to make sure that it's fair and that we don't hurt people. It's good legislation. 2001 or after, anyone has to abide by it already. It's already the law. The problem is that any facilities or corporations that were established before 2001 don't, and that's why we want to pass this bill. It's getting a considerable amount of resistance from the industry. I look forward to working with the Aarp on the issue. I believe it's something that absolutely needs to be done. Some of what's in our legislation is already being done by the Department of Health through regulation, notifying family, allowing them to know that they can contact the ombudsman if they need help, giving them the facts they need if they're involuntarily being pushed out. That's good information, and that's already being done, and that's part of our legislation. That's number one. Assisted living, really important issue. Secondly, and really Doug covered it well, and we're proud to have been co-sponsors of the legislation to ensure that when people have really been themselves, have received the result of a medical error, that they should know that people should know in hospitals what the issues really are, what the conditions are in a hospital, etc. It's your body, it's your health, it's your right to know how you're going to be treated and what's happened in that facility in the past. Thirdly, the budget. And as I said, unfortunately, I can only stay a little while, but I will take a couple questions. The good news, let me do the good news first. Good news, and I do congratulate the governor on this, he really has taken care of our seniors. In the most extraordinary of times, with the greatest of challenges, seniors have been relatively held harmless, and that's a good thing. Your property tax rebates are going to be there for seniors that are earning under $150,000. Like everybody else, they're still going to be able to deduct their taxes on their, take that deduction when they actually file their tax return, as well as the PAD program has been kept intact, as well as the senior citizen property tax freeze, which is known as the PTR. All of that is kept intact. That's the good news. Education relatively intact. That's the good news. Not such good news for our region. Really serious concerns I have, and some of you may have read, we are a very, when I speak of bipartisanship, we are a very bipartisan legislative team. When we believe Democrats are right, we support them. When we believe Republicans are right, we support them. When we believe Republicans are wrong, we don't. And when we believe Democrats are wrong, we don't. Because our job is not to represent political parties, it's to represent our constituents, our people, and the state of New Jersey. There are some serious budgetary issues. The state of New Jersey, and indeed to some degree the federal government, has done for a great number of years, has approached fiscal issues in an inappropriate way, hasn't been fiscally responsible for a whole host of reasons, and I could spend hours speaking about it, and I'm not. We as a legislative team for a number of years have proposed a 10-point plan. Sometimes it's been 9 points, sometimes it's been 10. The points are growing to say that there's so many things we could do better. The millions of dollars that we spend upon printing alone in the state of New Jersey, we get mounds of information. To this day, we still get it. Color brochures and glossies, fold-outs, pop-outs, calendars from commissions, authorities, and agencies. It's so many millions of dollars, the Office of Legislative Services said they couldn't get their hand around it. That stuff should be on the internet for those that need it and want to access it, and for those that need it in hard copy and printed form, including constituents, it should be the responsibility of the legislative office to print it out for them. It's not a big deal to do. Almost nobody looks at it. Almost none of the legislators read it. There's mounds of it. I had a press conference, again in a bipartisan way, where a number of years ago, we've been talking about this issue for years, we mounded up all the material in our legislative offices, and we mounded it up only for a few months. It was waist high. The cost of mailing that information is $5 and $6 and $7. I could show you the envelopes. It's just one little example. That's millions upon millions of dollars. There's many ways. The size of the fleet of the automobiles, the number of automobiles we have in the state of New Jersey are too large, too great. Many of them sit idle. We have a plan to reduce that 10% of the year over 5 years. I'm not going to go into all of it. But because of that issue, because of the issue dealing with South Jersey and beach replenishment and tourism and some of the issues that affect our economy intimately and affect all of you, even if you're not involved in it at all. For example, if it's left only to the towns and to the county for beach restoration, it's going to affect our property taxes. It's not a good thing. I'm going to give you one example, and then I'll take a couple questions, and why we have problems with this budget. We know cuts have to be made, and we know that these are extraordinary times. But we also know when you make a pledge, a promise, and a commitment, that you should keep it. Beach restoration, I'll give you one example. Beach restoration, a number of years ago, it was established that from the realty transfer tax, which means every time you buy or sell a property, vacant property, or that has a facility on it, has a home on it, or a commercial property, that every time you do that, a realty transfer tax is paid. From that tax, it was guaranteed that $25 million a year would go into the Beach Nourishment Fund. $25 million a year, guaranteed. We have the best beaches in the country, basically, definitely the best beaches on the East Coast. That fund has been very solid and healthy because we've never harmed it, just the way our pension fund used to be one of the best in the nation, just the way our unemployment insurance fund used to be the best in the nation, because we didn't invade the integrity of those funds years ago. And then Republicans and Democrats together changed what they did, and they started budgeting in a way that was irresponsible, and that's why we're in trouble now. We've never done it with the beach money. Last year we just started. This year we're doing it more. And we refuse to support that, because what's happened is we're going to lose the integrity of that fund, and we're not going to have it, and it's going to affect the beaches throughout the entire region. Cape May County is a huge recipient of that money, and then ultimately it's going to hurt the communities, the county, the rateable base, and everything else, and that's not good. What particularly bothers me about it is not that it was cut, if it was cut to a certain minimum level, but the way it was established. Because when that legislation was established, people knew, legislators knew that people were going to try to take the money. So they established something called a poison pill, which meant that there had to be a guaranteed $25 million that came out of that realty transfer tax. And if it didn't, if the money wasn't, if you didn't take the money,